So homeless healthcare started out as being a simple GP practice for people experiencing homelessness. We've grown a lot from there. My name is Andrew Davies and I'm a GP and the CEO and Medical Director at Homeless Healthcare. So I'm a GP by training. I felt like we weren't really dealing with what the underlying problem was for people. The fact that they're homeless is what drives their poor health. So I felt like if we weren't being more proactive in dealing with the homelessness and trying to help people get housed, that we weren't really dealing with their health problems. 2 o'clock one morning, I woke up and went, I know what I can do. I can use the front room of my house and have all the right equipment so I can pack a GP surgery in the back of my car, go down to drop-in centres and set up, provide basically a clinic within a drop-in centre. The service actually sees about 2,500 people a year. I think last year we did about 29,000 occasions of slight care for people. There will be like a mobile clinic in the morning, might have a clinic at the hub in the afternoon. I do home visits a couple of times a week, so that's just going and visiting people that have been rehoused that are struggling to get in to see us. Go over to the respite centre, usually get the weekend shift for that one. But yeah, it's different every day.
Prior to working with Homeless Healthcare, I hadn't heard of them, I didn't know what they did, and I've been working with them for about a year now. Hi, my name's Maeve, I'm a registered nurse with Homeless Healthcare. I work at our medical respite centre and on the Homeless InReach team for Perth. I've been a registered nurse for about 6 years. I've worked in several different hospitals and different medical settings. I've worked in psychiatric settings as well. And I've always loved being a nurse. I love looking after people, but I always found it very challenging emotionally to work in hospitals that are under so much time pressure to discharge people quickly and get them back out. I walked into this beautiful old heritage listed backpackers building that we run out of and heard about the service and heard about Homeless Healthcare and was instantly completely in love, honestly. And since then I've worked for Homeless Healthcare full time across 3 of the different services. I work at the hub, the head office, I work at the respite centre, and I work on the Royal Perth Homeless team, and it's just the best job that I've ever had. There's the street health outreach service. The benefit of that is that people who aren't regularly engaging with other services, they're not going to GP appointments, they're not going to other community centres, aren't being lost on the streets, they're being seen regularly by staff who get to know them really well and build that rapport and build that engagement with them. People who may be distrusting of medical services, who are afraid to go to the doctors or afraid to go to hospital, are still cared for and are still seen, and gradually over time we're able to engage them in care. Then we also have clinics that we run at the different transitional accommodation services like the Beacons and Barts, places where people are staying but don't operate as medical services. We go there to provide medical care several times a week. We run clinics with a doctor and a nurse to do prescriptions, help with medication, see how people are travelling, do COVID vaccine clinics. That was a big part of what we've been doing over the last year. Then we also have a Royal Perth InReach service. So we go and we see people mostly in ED, in the emergency department, and we check in with them, we see what's brought them into hospital, we see how they're travelling. Most of the time, unfortunately, we know them quite well because due to the cycle of homelessness, they're presenting to ED regularly for support because it's the only place that they're able to get care. If they don't have other support services, they come to ED for somewhere warm and safe, and we can from there sort of liaise with the medical team to see if we need to advocate for them to stay in the hospital or if we can refer them onto transitional accommodation or other services. And that links beautifully with the service that we offer here at the Respite Centre because we can do referrals from the hospital to here, our Medical Respite Centre, the MRC. So we're a 20-bed medical respite facility where people can be referred from the community or from hospital settings when they are experiencing homelessness, they have no stable or safe accommodation, and they have an ongoing medical need that requires attention. So we're staffed by nurses 24 hours a day, and we have doctors come in to run clinics 7 days a week. We also have caseworkers from Uniting WA who work here doing the social side of things. They do incredible work with people doing Centrelink and photo ID and housing applications and all of the things that are really complex and challenging for people to navigate unsupported on their own in the community. We're lucky here where people are staying with us, they're safe, they're still in one place for a period of time. We're able to get those sort of things coordinated for them. And once people are discharged from us here, they can then come and see our GPs at our head office clinic, the hub, and be followed up by doctors who know them and who understand where they've come from and understand their journey in that system between all of our different services to make sure that people are supported by people who understand them and understand their complex, often traumatic circumstances that have led them to the experiences they've had.
Assertive outreach is the persistent, purposeful and proactive approach of delivering primary health care to people experiencing homelessness. My name is Natalie Bogoyas and I am an Assertive Outreach registered nurse for homeless healthcare. The work that I do as an Assertive Outreach nurse is taking primary healthcare or nurse-led healthcare to people experiencing homelessness who are actually on the street, so rough sleepers. So these are people who are living in doorways, they're living on the city streets, in parks, and we focus our service around Perth Metro area or the CBD. The main goal is to engage with people, to build rapport with them and try and provide basic health care to them right there and then on the street, and then with the ultimate aim to try and engage them in more comprehensive healthcare. And then we also have our medical respite centre, which we can refer people from street into the centre if they have some kind of acute medical reason, or if they're wanting to complete a detox through our alcohol and other drug service that we offer there as well. So why do we need to take our service, our medical service, to the people? The reason for that are there are just so many barriers for these people. Generally, they'll be affected by drug and alcohol, they'll have mental health issues, their lives are chaotic, just trying to exist and survive on the streets. So it would be really ridiculous to expect somebody to come to an appointment within a doctor's surgery at a certain time. It just doesn't work.
Morning guys, just checking in you're all okay. All good? Would you like us to come back later? You got caught?
Today? Yeah. Do you need any help, mate?
Okay.
Hey, we got to go see someone. If you want, we can come back in like 10 minutes. Yeah?
Sometimes I wonder how I would feel if somebody came into my lounge room at home and asked me how I was going and how's my health. So it's really a certain skill to be able to engage with people and come into their space and their environment and feel comfortable with them and engage with them so that they do feel at ease and open to receiving support.
We had a referral early on in the service for a woman who was in her late 50s, had always worked as a professional her whole life, had supported herself, had been independent with her finances, and then due to COVID had lost her job. She was then living off her super, which she was able to access due to COVID. She then spent a significant amount of her super on living costs, on rent, on day-to-day living. When the moratorium on rentals ended and she was evicted from her rental, she couldn't find another one. She couldn't find anywhere to go. She was also struggling with breast cancer. And so was admitted to hospital for surgery for her breast cancer and was discharged from hospital to the streets with a drain still in post-surgery. Was found on the streets by one of the caseworkers who works in the community, does an amazing job, and was sent back to hospital, where she fortunately received a referral here, and we were able to support her medically through that. And that for me was really eye-opening, that hospitals can discharge people to the streets while they still need medical care. I didn't know that was possible. And that's a real space that we are very privileged to now fill, I think.
We looked at 3 years of their hospital use prior to them becoming a patient of the hub and 3 years after. And the reductions in the 3 years after were about 40% for the ED use and also the inpatient use.
The relationship is basically everything. So being able to develop rapport with people and to build that trusting relationship, that, you know, nothing functions or happens without that. Do you take anything for high blood pressure? Are you taking? You haven't got none. If I got all your meds sorted out for you, where could we leave them? Like, what pharmacy would you be able to get to?
I work with an amazing team of people who bring their own incredible life experiences and compassion and empathy and wisdom into this job. And we meet the most amazing people every day through this work who I learn so much from, and I'm humbled every day by this job, and I feel privileged every day to work in this sector. And I think I'm surprised every day by the amount of, I'm going to cry, by the amount of joy and levity and gratitude that people bring to this space, even in crisis and even from the most horrendous life experiences that I can imagine, and all of these struggles that are so profound, and yet people bring joy and humour and humility to this space, and it is such a privilege to work with people who can teach us so much and who are so wonderful to work with.
Oh, thank you so much. You're an absolute
That's all right,
angel in
darling.
disguise.
Oh, that's okay, darling. My pleasure.
Thank you so much.